Do you know there are about 660 new cases of cervical cancer worldwide every year? And in 2022 alone, about 350,000 women died of cervical cancer. And this also makes cervical cancer the fourth largest kind of cancer that affects women everywhere in the world. Women from low-income countries or low-income areas are more likely to die from cervical cancer because there is no vaccination available and there is no screening available. And most of all, so if you look at some of these countries or some of these areas, the education that women have around cervical cancer is also deficient, which makes it difficult for them to know what to do or even detect the signs and symptoms early enough. So, what is cervical cancer? So, cervical cancer, just like any other cancer, is a tumor or abnormal growth that is found in the body. But in this case now, this one is found specifically in the cervix. The cervix is the narrow lower part of the uterus that connects the uterus to the vagina. So the cervix is just like a junction between the uterus and the vagina, and it is the cervix that usually open before a woman is able to deliver through the vagina. And because of how this part of the body is, just like any other kind of cancer, if the cervix is affected and it is not seen on time or managed on time, it means that the vagina can be affected, the uterus can be affected, and it can even spread to distant part of the body as well. So, what are the risk factors or those things that can expose you to cervical cancer? The most common cause is HPV. So, HPV is human papilloma virus. Is a type of virus that can cause cervical cancer. Now, there are different types of HPV, but specifically HPV 16 and HPV 18 has been linked to causing cervical cancer. And this HPV is transmitted through sexual intercourse. So any activity that is bringing the genitals together is something that can transfer HPV from an infected person to someone who is not. The good news with HPV is that it has a vaccine, which means it can be prevented. So this HPV vaccine is usually given between the age of 9 and 14 years. That is the best time it can be given before a person becomes sexually active. Now, between the age of 15 up to 29 years, HPV vaccine can also be given. And also, even later in life, it can also be given, but it just has to be discussed with your doctor. They have to now weigh the risk and the benefit to see if it is something that you can benefit from. But mostly, the best age to give HPV vaccine is between the age of 9 and 14 years. Vaccination for HPV can help drastically reduce your risk of cervical cancer. So another thing that also increase your risk for cervical cancer is smoking. And just like many other kinds of cancer, lung cancer, smoking increases our risk of any kind of cancer, including cervical cancer. Another one is weaken the immune system. So if our immune system is strong enough, it's able to fight off certain things from our body. But if you have a weakened immune system, maybe because you've had a transplant, you are taking certain medications that will reduce your immune system from fighting off diseases, comorbidities like HIV and diabetes, all of this can reduce your immune system. So which means if you have any HPV infection at all, your body is not able to fight it off and then increases your risk of cervical cancer. Another risk factor for cervical cancer is the use of oral contraceptives. So studies have shown that there's a little bit of risk associated with using oral contraceptive, especially the combined oral contraceptive, because it kind of affects the cervical cells and also delays your body's ability to clear HPV virus. So there is that risk that is associated with it, especially for people who are using oral contraceptive pills for more than 5 years. Another risk factor for cervical cancer is multiple sexual partners. Just like I said, HPV, which is the main thing that causes cervical cancer, can be transmitted through sex. So someone who has multiple sex partners become more at risk now of contacting HPV, which will significantly increase their risk of cervical cancer. The next thing I want to talk about is what are those early signs and symptoms that can tell you that this could be cervical cancer. Just like any other cancer again, early detection can also save somebody's life. One thing I have to mention is that cancer is just that thing that the symptoms can just be anything basically. Like my interaction with patients who have had cancer is that Sometimes cancer can just give you any sign at all, which is why we need to be proactive if anything is not right. Even if it's happening in a different part of our body, it's always the best thing to actually check it out, because especially cancer is just one hell of a thing. Also, I'm going to mention that cervical cancer is something that can be there. The cells are changing, the tumor is there, and then you don't feel any symptom at all. However, some of the early signs and symptoms people notice with cervical cancer is usually bleeding. So this can be bleeding when you are having sex, or maybe bleeding in between your periods, so you're not menstruating at all, and then you start seeing bleeding. And also, your period flow can significantly become heavier than it used to be. So that is another thing. If a menopausal woman who is no longer menstruating, and then the person suddenly starts seeing blood, it is an abnormal bleeding and it is a sign of cervical cancer. So bleeding in between your periods, bleeding when you are having sex, increased menstrual flow, and bleeding for women who are menopausal. Another early sign is unusual vaginal discharge. So the discharge can become watery, color can become red, brown, pink, and then the smell become foul smelling. Now, it is also important that you differentiate this reddish discharge that I'm talking about from your period, because some hours before your menses or some days after your menses, you still have all those reddish discharge, which is part of your period. Now, this is a different case. In this case, you are not menstruating, you are not anywhere close to your menses, but you start seeing those kind of discharges. That is a red flag. Another sign of cervical cancer is pelvic pain or pain when you are having sex. Painful sex is not normal, and also depending on the size or how far this tumor is growing, you can have discomfort in the pelvic area. So if you have anything like that, it is a red flag that you should check out. Now, it is also important to know that it's not all pelvic pain that is cervical cancer, but if the pain is associated with other signs and symptoms, it is definitely something you should check out. And even if you are someone that don't usually have any pelvic pain, you don't usually have any pain during sex, nothing has really changed much with your daily life or activities, and then you start noticing pain when you are having sex or just pelvic pain, it is definitely something to check out. Another sign of cervical cancer is urinary symptoms. So this can be in the form of frequency in urinating. So you find out that the person might go more times to wee. There might be painful urination. There may be blood in the urine. And I wouldn't say this is an early sign, because for somebody to start having urinary symptoms like this, it means that the tumor is probably getting bigger and then it is affecting other surrounding organs. So this is a sign of cervical cancer, but it can happen in the later stages of the cancer. Also, unexplained weight loss and fatigue is also a sign of cervical cancer. So persistent weight loss, tiredness, especially if you are losing weight and you're not even trying, you haven't changed your diet, you haven't changed your activity, and the person is losing weight, and if you combine with any other of these symptoms, that is a big red flag that this could be cervical cancer. The good news is that cervical cancer is one of those few cancers that can actually be prevented, and the HPV vaccine has been shown to significantly reduce a person's risk of cervical cancer. So make sure, especially if you are young and you are still in that bracket to get that HPV vaccine, you should definitely get the HPV vaccination. Also, practicing safe sex can significantly reduce somebody's risk of cervical cancer. Aside from HPV, there is also pap smear. So pap smear is when they collect a little bit of cell or sample from the cervix. This sample is tested for HPV, and this sample is also tested for abnormal cervical cells that can suggest cervical cancer. So for every woman who is above 21 years, you are recommended to do this pap smear. Every 3 to 5 years, you should at least have one pap smear done. So it's able to dictate abnormal cell changes in the cervix before the cancer starts or before the cancer progresses. So pap smear is very, very important. So if you're in Nigeria, I'm not quite sure this is available in government hospitals, but people would normally get it privately done. If you're in Kenya, I've heard that they do it in most hospitals or privately done as well. So this is something that you can find out in your primary health care center or any government-owned hospital. See what is available, and if not, it's something that you can privately get done as well. In the UK, it's done every 3 to 5 years as well. And so every country would normally have where you can get it done. This is something that is important and that you can find out as well. And if you notice any of these symptoms that I've mentioned, it does not automatically mean cervical cancer. It's something that you should just check out. Sometimes it could be nothing, it could be more. And also, some of these symptoms I mentioned, they are more like the earlier signs and symptoms that you notice. If this cancer progresses, it can kind of be any symptom at all, because metastasis can occur, which means it can spread to the vagina, it can spread to the uterus, all other surrounding organs. So how far this cancer progresses will determine what symptoms the person is going to feel. But basically, these are like the most common early symptoms that people would notice if there is cervical cancer anywhere in their body. And if you've watched this video to this point, I'm begging you and I'm asking you, please subscribe to the channel. There is so much to learn from it, especially for women. So if you've watched this video to this point, whether you are a man or a woman, please make sure you subscribe to this channel. It's also a way of helping to support this channel to keep growing. Thank you guys for watching. Bye bye.